Good morning. Welcome to our podcast where we're talking with functional medicine practitioners and finding out exactly what made them choose functional medicine and how they are doing now compared to before. So today I have the pleasure of having as a guest Dr. Ukpong Nwankwo. She's an internist and also adjunct associate professor at Meharry Medical College in Nashville, and she is certified in integrative nutrition. Welcome, welcome, Dr. Wankwa.
Thank you so much. Thank you so much, Doc. I'm so happy to be in your space. Yeah, thank you.
My pleasure, my pleasure. So, I wanted to start by asking you what inspired you to transition from full-time internal medicine to this, integrative nutrition, to the functional medicine space, basically. Tell us a little bit about that.
Well, that is a great question. Um, and I would try to answer that as best as I can. You know, as a young child, I really loved to help people, and that was my passion. It made me feel good. And so I was drawn to a lot of medical shows. And being drawn to a lot of medical shows, automatically with time, I became a physician. I became a doctor. And so that has been, my passion. And because that was my passion, I really enjoyed being a doctor because I was helping a lot of people get better, feel better. And so that made me feel like I was being useful, I was accomplished. And so with time, I got married, to the love of my life. We had a daughter, and the workload became a lot, both at home and at work. The work kept piling on. And, being a doctor, I never slowed down. I just kept doing and doing and doing. And then one day, my husband decided he was going to cut off our health insurance and change it to a new one. And I was like, wait a minute, can I go get my mammogram? And that was where my life changed. I was called to come in for the results after having had a biopsy. And the look on the face wasn't good. It was like, I heard the words, you have an invasive, aggressive left breast carcinoma. Have you ever been afraid? I certainly was afraid. I was terrified. The seat under me enlarged. And I was like, how did I get here? I've spent all my life serving people. But like the airlines say, in case of the loss of cabin pressure, and you're traveling with a beautiful, sweet daughter, maybe a 2 year old, put on your mask first. And that's where I failed. I failed to put on my mask first. Forced to stop and take care of myself and go through the treatments and everything. And because it was an aggressive cancer, I was told that it was likely to come back. And one thing that I could do to help myself was to lose weight because I had piled on a lot of weight. I didn't pay attention to how I was eating. I wasn't paying attention to exercise. And then with the chemo, more weight piled on. So after going through successful treatment, thank God that's behind me 11 years ago, I embarked on a journey to lose weight. I tried so many things. And being a successful physician, it was so frustrating because I had, succeeded at my work, but in terms of losing weight, it was a pain. I tried keto, I tried the Cambridge diet, I tried so many things. And every time I looked at the mirror, it was a reminder of how I had failed myself. And then, having tried all that, I said to myself, it mustn't be that difficult. There must be a way for me to lose this weight and keep it off. And so I registered in an integrative nutrition school to answer your question. And it was for a year. I learned a lot of things about food, about nutrition, about nourishing yourself, about food that's on your plate and food that's not on your plate. And the one thing that I discovered is that diet like clothes have to fit you. And my aha moment came that everything I tried didn't work because it wasn't tailored to me, it wasn't suited to me. And so I found, kept digging deep until I found what worked for me. And I was able to release 70 pounds and keep it off. And as a physician, thank you so much. Thank you. I wanted to apply it to my patients because a lot of the patients we see are obese, and a lot of the illnesses they have is from their weight. So I started doing this, helping people. We tell people what to do as physicians, do this, don't do that. And I found out that that style wasn't helping my patients. And I went back, learned about coaching, how to help people, find their own answers. You know what? When you coach people, it's more gentle. They're able to accept it. They have the answers inside of them. You're basically pulling those answers out. Key in with the knowledge I have with nutrition. And it's been very rewarding, very, for me to help the patients and not just the people in my office, on my coaching space to be able to release the weight. Because a lot of women are successful, but their lifestyle, their health is not aligned with their success. So that's why I help women to align their success with how they look, how they feel, and their health, so that they can be, when you're aligned from your lifestyle to your health to how you look, your success is even much more. So that is what is inspiring me in the integrated nutrition space, in the coaching space, to help people in a way that is easier on their body. It helps them because it's unique to them, it's tailored to them. So thank you so much for that answer question.
Absolutely. It's amazing, right? I was also in internal medicine, right, for so long, for over 2 decades. And it's true, we've actually failed our patients in delivering prevention
Mm,
and in helping them actually fix the medical conditions, right?
mm,
In traditional medicine, it's such a, the status quo is control disease and
mm,
prevent complications. But it's not
mm,
about fixing. Why not get rid of diabetes? Why not fix your cholesterol? Why do we need to have bariatric surgeries when we're not fixing our cellular health to begin
mm,
with
mm,
and be able to lose, like you said, find the proper nutrition that fits you like a glove and find your way towards exactly ideal weight, healthy weight. Because when you're becoming healthy, right, at a
mm,
cellular level, then the weight comes off almost automatically. It
mm.
doesn't have to be this restrictive diet and, oh, let me try the newest fat diet out there. No, that's why cookie cutter programs don't work,
They
right?
don't work. They are very frustrating because it makes you feel like a failure when you're really not a failure.
Exactly. Exactly. It's um, unbelievable how oblivious traditional medicine is to really basic metabolic health,
Mm.
right?
Yes.
Absolutely. So, in your life as a traditional internist, traditional medicine physician, can you take us back there a little bit? Like, you know, how much better or worse it was compared to now? Like what were the positives and what were the negatives compared to now?
Well, like you said, the traditional medicine only focuses on fixing stuff. It's more paternalistic. It's telling what is inside the patient's body. You don't know how they feel. All the medicines and the things we are throwing at them, we don't know how they feel. But just little things that we can change in their nutrition would make them feel better, make their sugars come down, make their blood pressures come down. Even if they still need medicine, they might need less. And also, you're building rapport and you're establishing trust with them. Because a lot of people are now going on the internet, they're disillusioned with traditional medicine, they're losing trust in us. So we have to bring back trust by bringing those things into traditional medicine so that the patient doesn't have to go to the quack out there. There are people who are out there, doing stuff that's unregulated, but when we can do it in our space, in the safe environment, and bring back trust for our patients because they are looking outside anyway. They are.
Absolutely. Absolutely. Everybody's trying everything, everybody's buying all the supplements. They have no idea how good they are. They're taking advice from friends and neighbors. And because when they go to their primary care physician, they're not given any advice or any feedback on natural products, on supplements, on anything like that. And we did not have nutrition classes in medical school, right?
Absolutely not. We did
And
not.
it's mind blowing, right? Because we definitely are what we eat.
Mm-hmm, mm-hmm. And
Definitely.
just basically explaining how food works, the different macronutrients, the patients are able to understand and put it together for themselves, because and then let them know the impact of just eating high carb diets, what it does to them, how it's driving their diabetes. Meanwhile, we can, slow down on the carb side. We can do the high fat, the complex carbs, so just little things like that can help to somebody once talked about little hinges that swing open, wide open big doors. So little hinges like that in medicine, explaining to them the carb intake, the healthy fats, the healthy proteins, what it all does to you, what it does to your sugar, in terms of driving insulin resistance. Just that little basic thing. Because we keep going up on the insulin, going up on the metformin. Meanwhile, we can just adjust how they eat a little bit, adding more vegetables, doing the complex carbs, doing the healthy fats, the ratios. And those are the things that are the foundations to what we should be doing.
Absolutely. Absolutely. So when, you know, when you talk to patients now in this, from this perspective, what's the difference in attitude compared to your traditional patients versus these patients that are being told in a, being coached? What's the difference? What do you think?
The difference, I think, is that you get, they are more receptive and they are more apt to taking responsibility for their health. Uh,
Empowered.
They are empowered. Let me just give you an extreme example. This gentleman is about 30 years old, but he was intellectually disabled. He has the mind of a 4 or 5 year old. And working with him, he was 450 pounds. And, if you told him, don't eat this, don't eat that, he's just going to start breaking down walls. So I just instructed his caregivers on how to feed him, his vegetables, and everything. Can you imagine how much he lost in a year?
How much?
He lost over 100 pounds
Wow. Amazing.
without Ozempic, without what's the other name of the other one? I forgot.
Wegovy,
Wegovy.
Montaro.
Yes, that has a small percentage of people going blind. So this is someone who His mind is not totally there, but we found something that we were able to work around. He was still eating his pizza, he was still eating his hamburgers, which of course, if someone is mentally okay, they would be able to control. But this guy, this is his level of understanding, and we were still able to help him in that manner. So it's there's a huge difference. There's a huge difference, and I think that this ought to be introduced into the medical school curriculum, to start helping young physicians see this as the backbone of medicine, so that when we get out there, we can give a well-rounded approach to our patients, because they are responsive. Once you can get to that place of an agreement with them, they take ownership. And once someone takes ownership of what's going on with them, you get more results. You get more results. So the approach is definitely different. And I think I like the approach much better. It's made me a better doctor because now I ask questions and I listen and I get an agreement. What are they willing to do? What would they want to do? Because me just coming here and say, do this, do that, it's just going to go in one ear and go out the other ear. But once you get that level of agreement, you now have where to start with and where to build on. And, the outcome is different. And I love that.
Absolutely.
Yes.
Yeah, absolutely. Absolutely. I think um, children in school even are not taught responsibility.
Mm.
They're not taught that, hey, if you want to achieve success in life, you have to kind of take a different view and a different, level of responsibility. Have you heard about the story of the turtles and the giraffes? So where the giraffes are high, of course, they graze on trees and they, have a totally different view, right? A
Mhm.
huge, view about a much better view about life, about everything. But the turtles are on the ground and they only see the dirt, the obstacles that they have to move through. So people that kind of look only at the obstacles and the easy way out, and they don't want to think outside the box, they don't want to get out of the comfort zone, cannot see what the giraffe sees. And the giraffe, cannot get to the level of the turtle because then they would pass out actually, because of, they cannot look down too much. So it's so good because we empower patients, right? People, adults now, or even teenagers, to get the giraffe view and see what's possible for them, because one can literally design their health, right? And design their life. That's because if you don't have health, you have nothing, right?
Mhm.
So it's so possible, but you have to know, you have to be aware of so many things that would help you live a healthy life. If you don't know,
Someone once said a woman's health is her capital.
yeah,
If you're not healthy, there's a lot of stuff you cannot do. I am 61 years old and I have a newborn baby. Yeah,
wow.
I know. So, how can I do this? Is because I have gotten my health under control. I'm able to keep up with her, do the responsibilities. So, we have to, as physicians, switching things a little bit, take care of ourselves and be open to things that can help us help our patients, and also for those who want to transition out into something that is less stressful in terms of insurances, less stressful in terms of workload, less stressful in terms of hours, more flexible in terms of young family. Like, for instance, I'm out here talking with you because my practice, it's set up, I have my baby here with a sitter helping me next door. You can hear her. Downstairs, I have my practice and a provider seeing patients, and I can be here talking to you. I can be here coaching people online. So there's so many things that you can do when you look outside the box. You cannot read the label when you're inside the jar. You have to someone else has to read the jar for you, the label outside, that's outside. So as physicians, we have our noses down like the turtle. Let's look up. It's time to be the giraffe and look around and see what else is out there for you, because there's a lot out there. You know, I do speaking as well, I do coaching. I'm also an adjunct professor of medicine. So, how can you do that? Is because you have now decided to look from just keeping your nose into what you're used to, the grind, the grind, the grind, and you can look up and see other alternatives out there for you, in terms of practice. I still do practice, like in the afternoon, I'm going to go see patients, but at my own pace. Wouldn't you like that? I'm sure they would. I'm sure the doctors listening would love that, right?
Absolutely. I mean, I have always been in private practice, so I cannot even imagine seeing a patient in 15 minutes. I think it's such a stressful environment.
Mhm,
And the other thing is that you allow a third party, like insurances or employers, to practically evaluate your value and the needs of the patient that
mm,
only you and the patient know the best.
mhm,
And it's so, it, it's not the right way, because
mm.
I think every person, people don't understand that everybody needs a personalized approach. It's not about a
Absolutely.
disease treatment algorithm. It's about
Mm,
your unique needs in that disease, maybe. But,
mm,
we look at all the different root causes and of medical problems, and there's so many and so intricate that it's a labyrinth that obviously people can only decipher with professional help.
mhm,
And I think that in coaching them in the nutrition and in cellular health, it is the way to go. Definitely. I mean, we've heard so many wonderful stories of cancer cures, right? With people that took their health in their own hands and went a different route, right? Not the um, generally accepted as the standard route, right? While the
mhm,
others, not so not so many happy ending stories
mm.
with traditional and algorithmic approach. So, but why do you think so many physicians are oblivious to alternative, integrative, and really functional medicine, which is a science?
Mm.
Why do you
Well,
think?
I think that, as physicians, we are trained to think of our things in a certain way. And so getting out of our comfort zone is uncomfortable. I
Mhm.
think that is what stops them, is like, how are they going to make it work? How does this work? And when someone doesn't know how something works, so it's better to stay in that comfortable place where you're sure about a certain amount of salary every month. I've been in, first of all, going from being fully in academia into private practice, and I'm on adjunct faculty at Mehari. So that also took a big step, because you go now going into that space of coaching is an entirely an integrative nutrition, different from what you're used to. So people like to stay with what they know. So that is where the hesitancy comes in. But when you get out there, because when you're learning something, learning about the functional nutritional space, learning about integrative nutrition, it's not the regular medical school. It doesn't come like, for some people, it might come easier, but it comes with a lot of effort, putting effort into it, investing in learning from other people, So that is where the inertia comes. And moreover, is that we are overworked. We are grinding, grinding, grinding. So there's not enough time to think about what else to do.
Mhm.
See, my own time came because I was sitting down in the oncology office, sitting down for hours, taking chemo. So I had time on my hand to go online and see what's going on, but the regular doctor doesn't have that time. After work, you're back home writing notes and nodding and nodding to finish up your notes, and you never can catch up with finishing up your notes. So, this is an area that, you know, people have to be intentional about looking into. And the rewards is also there financially in the sense that it can free you up to do more of what you would like to do rather than just, but because I still like to do the regular medicine, I still integrate it somewhat into my day, but I still have now more enough time to do what I'm trying to do, you know, get also with the help of virtual assistants. So there's a way to do it. And actually, I with all that went on with me, I wrote a book as well, the last weight loss program you'll ever need. So when you're the giraffe looking up, you can see the possibilities. If you're not looking up, you can't see it. You can't see it
Right.
because you're exhausted, you're tired, um, and especially as women, you go back home, you gotta cook, you gotta clean, help the kids with homework. It's an unending work.
Absolutely, absolutely. And sometimes, right at the beginning, when we transition, it feels a little bit lonely because you might
Yes,
have your close friends maybe, or your husband, your family cheering you up, but everybody else is looking like you at you as like, what's wrong with you? Well, what do you mean, integrative anything, or alternative anything, or functional, you know they they have no idea, and they say no, right? And it feels a little
yes.
bit lonely initially. But
It
when you
is.
know in your heart that you're doing the right thing, doesn't matter.
Yes, it doesn't matter when you know in your heart that you are doing the right thing. You just have to keep the focus and stay away from shiny object. Every small thing that comes, you change, you change. If you can keep the focus, keep working at it, before you know it, it will materialize the things that you're looking to do.
Absolutely. And plus, you're able to reach so many more people than just the ones entering your office, right?
Right.
Your area of impact and influence and life
Influence.
changing
It's
in
worldwide. It's
expand.
worldwide.
Exactly. And that feels amazing, right? Correct?
Yes, absolutely.
Absolutely. Because I think all of us going into medicine, we want to impact people's lives. We want to
Yes.
make things better for them. And the more we know what's right, and the sooner we put our oxygen mask on, the better our brain functions and our views expand, and we can help more and more people.
Yes. Yes.
Absolutely. Um, I wanted to ask you, like, if you were to write yourself a letter describing your life 10 years from now, what would you say? How would you describe your life 10 years from now?
I would say, Ukpong, you did it. You broke loose from traditional path and created for yourself an extraordinary movement, transforming so many lives, countless women. And you are a trusted calling blended science of compassion is and redefined what is called healthy. You're vibrant after 60. Your impact is visible in every woman who found her energy through you, who looked at the mirror and saw strength instead of struggle, and who finally prioritized without guilt. You didn't just guide them, Opong, you walked the path with them. You walked the work. You kept learning, adapting, and expanding your reach, proving that transformation isn't about age, but about choice. And so you chose it. You built a community where women felt safe, empowered, and capable of rewriting their health stories. And look at you now, a living proof that everything you teach, strong, joyful, still challenging the status quo, still walking over 10,000 steps, still inspiring. You didn't settle for a title, you embraced a mission. And that mission continues to ripple out, changing lives in ways you never imagined. So keep on going, keep on evolving, and never forget it. This was meant for you, Upong. Well done.
Wow. Wow. This is amazing.
Thank you.
Amazing.
Thank you.
And think about, and when you think that, you know, 15 years ago, you would not have had even a third of that view to write yourself that kind of a letter,
Mm,
right?
absolutely not.
Absolutely not. It's amazing and it's so exciting, right? To live
Yes.
and to build a future. And
Yes.
it's also a legacy for our children
Mm,
because they see that you're okay, I don't stay in the comfort zone.
mm,
It is not acceptable in
mm,
order to the um couple of people, like Zig Ziglar says, in order to obtain what we want, we have to help as many people have what they want.
mm,
And we have to grow in our goals, right? But you have to get out of the comfort zone because nothing great was ever created in the comfort zone.
mm,
But only when we step out, we have the courage. And obviously, we have to have the passion to do that. But it's amazing. But like Jeff Bezos said, it's the few that are called the crazy ones now, but that will change the world.
mm. That is so true.
Believe I believe that that's definitely the mission, if you want, or the um, unspoken mission, that heartfelt of integrative practitioners and everybody that steps into the coaching and online helping people and to impact their health, because in the end, the more lives you change, the more satisfaction and the more reward rewarded you feel, right? As a physician, definitely.
Yes.
And what more beautiful thing than to help our children see that health is possible no matter what,
Mm-hmm.
and that they can definitely design their life around the job, not I mean the job around their life, not the other way around. I mean, you don't first get a job and then, oh, whatever life I get. No, 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 no. You build the life that you want and you choose the job that fits that, the
Mm,
vocation. The It's not,
mm,
yeah, you cannot even call it a job, right? Because if you think about it, right, you don't consider the coaching a job,
mm, mm.
right? Because
Right.
you love it, you're passionate about it.
Mm,
So it's interesting because a lot of definitely employed physicians would say, oh yeah, I have a good job.
mm. That is true. But even that, at that, with time, it becomes obvious that that good job is sucking the life out of them. They are not able to do what they could have done for their families. I just spoke with a colleague. He's a guy. He is like 5 years older than me. He says he's going to retire because he's not had time to live his life, you know. So he wants to now live his life after 65 years or so. He now wants to live. What about the rest of the time that has gone? We need to reclaim as much life as we can. Oh, yeah.
Absolutely. I think people don't really see that time is priceless. You cannot
Mhm.
buy back time, and they don't live their lives. And then we see that more people have more regrets of what they did not do
Hmm.
later in life, not what they did,
Hmm.
what they
What
did
did they
not
really
do.
do? Hmm.
So I hope that through these podcasts, through you and other physician guests, we're gonna spread the word about this mission
Hmm.
to empower yourself as a physician, ourselves as physicians, and get out of that box, get out of the routine, get out of the status quo, and look for other possibilities and be open to learning, because we always learn. We always need to learn. If we don't learn, we don't progress. And without progress, you're not happy,
Hmm.
really happy. And I think it's a way to build freedom and to buy back time, and definitely to make the world a better place, to empower more lives, to take responsibility for their own health and to know what to do, make them aware.
Hmm.
And I definitely value your contribution,
Oh, thank you
and
so much.
you have an amazing heart
Hmm.
and amazing influence and impact on so many professional women, and this will just spread as fire. And
Hmm.
like you said, it's global. So
Hmm.
let's keep this going, because it's only going to take over your practice, and
Wow.
you will definitely expand more and more, and coach more and more people. um
Yeah, I want to thank you, Dr. Catalina Brija, for your platform to do this for physicians, to enlighten them to what is possible and what is out there for them, and how they can start living fuller lives before life is over. So, yeah, don't wait until you get a diagnosis of cancer like I did, or don't wait until you get old or too old to make changes. Now is the time. You can do it. Yeah.
Absolutely. We can do anything we set our mind to.
Yes. Yes.
Absolutely. Absolutely. I appreciate your time. Thank you so much for coming on the podcast. And we'll see you soon. We'll talk more,
All
uh,
right.
and
Thank you.
share more experiences. My pleasure. Have a fantastic day.
And you
And for
too.
people that want to find you, you're located in Nashville,
Yes. And
correct?
I'm on Facebook as Ukpong Nwankwo. Yeah.
Absolutely. We'll post all the links for
Okay.
everyone to find you and take advantage of your expertise, because they will definitely gain a lot from this.
Thank you so much.
Thank you so much. Have a great weekend.
And you too.